like this, and when you do that, your heels kind of push out on the bed, or they pull back like this. Sometimes that kicking out or bending like that on the bed or in the wheelchair can cause you to hit things, or your heels to rub on the bed. And when you have that rubbing going on your heels, it can cause breakdown, friction and heat, things like that. We'll talk about that a little bit too. Here's an interesting one. It says depression. Why would we talk about depression as a risk factor for skin breakdown? What's the correlation between the two? What happens sometimes when people are depressed? Where do they want to stay?
Don't want to get up, don't want to wake.
Yeah, they don't want to get up, they don't want to do anything, they want to stay where?
Just stay in the bed.
They want to stay in the bed, right? It's a very real thing. You know, our hospital is a hospital for what we call catastrophic rehab. Okay? We're not just your basic kind of hospital for general rehab. Our hospital is a hospital for catastrophic rehab. That means there's been some sort of a catastrophe to your body, okay, to your spinal cord, or whatever has caused this issue, cancer of the spine or whatever. And it's a big time event, all right? And it's not something where you just sprain an ankle and you're good to go in a couple days, all right? So it's a lot to deal with. Our patients have a lot to deal with. Our families have a lot to deal with, okay? You're thinking about a lot of things, worrying about how am I going to get stronger? Am I going to go back to school or work? Am I going to stand? Am I going to walk? And before you know it, your mind starts kind of thinking about a lot of stuff. And when your mind starts thinking about a whole lot of things over here, you kind of get in this cycle. Before you know it, it can lead to depression. And then you don't really want to participate and do things. So sometimes when you're in this cycle of depression over here, or you're kind of worried about a lot of things, or stressed about a lot of things, and your mind is stuck over here, that means your mind is not over here, where you're focused on your rehab and your recovery, and you're taking care of what you got to do to go to therapy, get yourself better, get yourself home, to back to school or work or whatever it is. So we got to get your mind kind of over here where you're focused on rehab and recovery, and we don't want you to be over here in this place where you're kind of in this cycle of depression. So sometimes your doctors may recommend that you take something. Doesn't mean you'll be on medication forever. Doesn't mean you'll take medication forever for depression. It just means you'll be on something right now while you're dealing with this, so that we can get you from over here to over to this side where you're focused on your rehab and recovery. Okay? Same thing for families. Families all the time, oh, I don't need to take anything, you know, blah, blah, blah. Well, guess what? You've never been in the situation where you've had a family member had a spinal cord injury. So for families too, it's important to take care of your mental health as much as your physical health, okay? So really think about some of those kind of things, okay? Because we certainly don't want you in a place where you're wanting to stay in bed and you're not remembering things like your weight shifts, you're not remembering to cath on time or to take your meds or whatever you need to do, okay?